As I recovered from my femur and knee replacement, I was required to walk non-weight bearing with crutches for 6 weeks, followed by partial weight bearing for another 6 weeks, before gradually working my way to full weight bearing as tolerated. I then had to undergo at-home physical therapy for 4 weeks and then attend outpatient physical therapy. I only attended physical therapy during my off chemo weeks since chemo days in the hospital were long. I also had to approach physical therapy lightly during my time in chemotherapy because the chemo for bone cancer makes the bones weaker. This conservative approach to rehabilitation required a lot of patience and caution, but if it was what the doctor ordered, I did it. It was not long after the tumor was removed from my leg when my oncologist shifted focus to nodules that happened to be present in my lungs. These suspicious spots were discovered in the beginning of treatment, but were not prioritized up until this point. I had to undergo an operation to have those nodules removed. I had my first lung surgery on November 6, 2014, in which they cut open my back and removed the nodules through a thoracotomy procedure. The nodules did turn out to be osteosarcoma that spread from my leg. However, the chemotherapy had already killed those areas of cancer, which was a promising sign that my treatment was working. While most patients usually stay in the hospital after this operation for 4 to 5 days, I was the only patient my lung surgeon ever had who was discharged after 3 days. However, this record-breaking short stay was not done without the severe pain I felt in both my back incision area and my ribs where a tube was placed for the blood to drain. I couldn't push off my arms, squeeze the area of my back where the incision was located, nor could I laugh, cough, or sneeze. Despite these difficulties, I was able to breathe all the way up to the top of the spirometer, which is typically a hard task to complete after a lung surgery. I returned to chemotherapy a few days afterwards, hopeful that I would not need any more surgeries. Then on January 15, 2015, I had to go through another operation for my other lung. The second thoracotomy was done to ensure no cancerous nodules were there as well. While no nodules were viewed on the x-ray for this lung, my doctors wanted to ensure that there was in fact nothing there. Thankfully, no cancerous nodules were present this time. The pain this time was also not as severe, and I was again out of the hospital in 3 days. Now my back contains 2 scars in both shoulder blades and resembles torn out wings. While I never wanted any additional surgeries to treat my cancer, it was very reassuring to know that the cancer was out of both my leg and lungs. Now it was time to move on and finish the rest of chemotherapy as I was inching closer to cancer freedom.